global health. Please take a seat and turn your phone on silent.
Health is our most valuable asset, essential across communities and cultures in every region of the world. The Virchow Prize for Global Health honors those who dedicate their lives to improving health and well-being for all, recognizing outstanding contributions within the broad and complex field of global health. This unique prize is named in honor of Rudolf Virchow, a renowned physician at the Charité University Hospital, Berlin. Known as one of the fathers of social medicine, Virchow united in one person the interdisciplinary and humanistic concept of well-being, which is needed today to improve health at a global scale. Like Virchow, laureates of the Virchow Prize for Global Health are examples in striving for these noble goals. Because health is more than just medicine. Promoting global health is the aim of the founders of the Virchow Prize for Global Health, which is awarded each year in Berlin, a city with a history unlike any other. Berlin today stands for humanitarianism, innovation, science, and medicine. In this spirit, the Virchow Prize aims to create a ripple effect in global health, from Berlin to the world, inspiring great minds and future generations in their commitment to creating a healthier, more sustainable planet. It is with this vision that the Virchow Prize for Global Health closely aligns with the United Nations Sustainable Development Goals, upholding health as a beacon, highlighting the importance of health and its interconnectedness across our global community, because health is a human right. Welcome to the Virchow Prize for Global Health Award Ceremony, honoring lifetime achievements and dedication towards health for all.
Ladies and gentlemen, please welcome on stage your Mistress of Ceremony, Dr. Ayoade Alakija.
Guten Abend, meine Damen und Herren. Guten Abend, liebes Berlin. It is such a pleasure and an honor to be here with you this evening. This is a very special occasion, and we're here together to honor the second laureate of the Virchow Prize for Global Health, Rose, Gana, Fomban, Leke. Imagine a world where health transcends borders and profit. Picture a realm where medical education is not a pathway to wealth, but a promise of community well-being. That's the world Rudolf Virchow envisioned and tirelessly worked for. Tonight, as we gather under the banner of the Virchow Prize for Global Health, we're not just celebrating an award or a laureate, we're championing a legacy. In its essence, this prize, bestowed by the esteemed Virchow Foundation, stands unique and unparalleled. It is not merely an award, it is a testament to global health's vast tapestry, which is shown here in this room tonight. I've seen so many of you sisters from Cameroon, people from all over the world. A tapestry that we mean to weave together to ensure that we truly have health for all. A tapestry deeply interwoven with the United Nations Sustainable Development Goals. So we come together this evening to salute the remarkable Rose Gana Fomban Leke. Through her work, she exemplifies the spirit of the foundation, seamlessly bridging complex realms to ensure better health outcomes for all. In the words of Virchow himself, medical education does not exist to provide students a way of making a living, but to ensure the health of the community. Before we begin the ceremony's proceedings, as not everyone may yet be familiar with Rudolf Virchow and his work, I'm thrilled to present a captivating video curated by Alex Funke and Vincent Engel from Funky Donkey Production, I like the name, dedicated to Rudolf Virchow and his indelible mark on global health. let this visual treat not just inform us, but inspire us.
He was a political activist, archaeologist, doctor, publicist, pioneer, for sure a workaholic, father of modern pathology, and the grandfather of nowadays hipster. Rudolf Virchow. Born on the 13th of October in 1821 in Schivelbein, in the rural Polish province of Pommern, he soon realized that Berlin was, and still is, the place to be. In 1839, he started his medical education at the Pepinière Military Medical Academy. He asked his parents for money to keep up with the latest Berlin Fantasy-Geschmack. Only a year after graduating from medical school, he had such an abundance of revolutionary ideas, he decided to found his own journals as an outlet. The Archive for Pathological Anatomy and Physiology, nowadays short Virchow Archives, are one of the oldest medical journals still published today. As a born revolutionist and fighter, he fought on the side of the Democrats in the 1848 March Revolution in Berlin, being part of the Democratic Congress. Consequently, losing his new position at the Charité Hospital, he swore to abstain from further political activities, and was hired as a professor in Germany's first Institute for Pathological Anatomy in 1849. In Würzburg, he not only found scientific fulfillment, but also the love of his life and children, and more children. Passion drives performance. Being held from further political revolutions, he turned to medical revolutions instead, overturning old ideas of humoral origin of disease. That's bullshit. His best friend at this time? His microscope. After 7 long years in Würzburg, in 1856, Berlin finally was ready for Virchow and invited him back as the chair of the newly established Institute of Pathological Anatomy and Physiology at the Charité. In 1858, he published the seminal work Cellular Pathology, the Bible of pathology and the foundation of cellular biology as we know it. Omnis cellula e cellula. In his work, the Pope of Pathology also described the trinity underlying all of our understanding of thrombosis and embolism, the Virchow Trias, giving jobs to thousands of strokologists, cardiologists, and hematologists around the globe today. He precisely described diseases and coined terms like leukemia, chordoma, parenchyma, and amyloid degeneration. His true love, however, always remained with the individual cells, describing new ones like the microglia and finding the cellular origin of diseases. In his eye, politics was nothing but cellular pathology on the bigger scale, so, technically, he was not breaking his oath when he started climbing the political career ladder and founding the liberal Deutsche Fortschrittspartei. Progressive ideas, even up to our standards today, we need public health care, soon attracted the rage of the political elites again. In the great sausage duel of 1865, Otto von Bismarck, the president of Prussia, was so fed up with Virchow, he challenged him to a duel to the death. It's either you or me. Virchow cleverly used this to make his point of the importance of hygiene and meat inspection, choosing trichinella-infected sausages as the weapon. With Virchow's help, Berlin became one of the first European cities to get canalization and central water supply. Whenever not busy revolutionizing the way medicine describes diseases or fighting for higher social standards and better working conditions, he liked to travel. And because he collected a whole lot of stuff on the way and his archive for pathological samples was overflowing, he decided to put them elsewhere. Where else but a museum? 2 of them, one for ethnology, one for pathology. Virchow, many concluded, can't be the name of a single person, but must be the term describing a collective of workaholics living around the turn of the century.
To open tonight's celebration, it is my extreme pleasure to welcome and to introduce the governing mayor of Berlin, Kai Wegner. He's very generously opened the doors of Rotes Rathaus Berlin for us this evening. And as you all know, those of you who live here, They say Berliners have a way of both making history and hosting a legendary party. So tonight we're very fortunate to combine both, and we started to see some of the fun emerge in that little video. So here within these historic walls of the Berlin City Hall, we're making this a night to remember. Mayor Wagner will give his speech in German, and headphones with translations to English have been provided to all of you on your seats. Mayor, over to you.
Dr. Alekija, Dr. Moeti, Friede Springer, Professor Ganten, Professor Prize, Dr. Haug, Mr. Goethe, and of course, my warm welcome goes to this year's laureate of the Virchow Prize for Global Health, Professor Leke. I welcome all of you, ladies and gentlemen. I am more than delighted to be here tonight to welcome you on the eve of the World Health Summit in Berlin. It's the second time that we are awarding the Virchow Prize for Global Health here in our city. So welcome to all of you, welcome to the Red Town Hall, welcome to Berlin, the healthcare city. Let me just say briefly, in the light of current events. 1 week ago, roughly, a brutal terrorist attack took place on Israel. And my hearts and thoughts and prayers are with the people in Israel. Germany and Berlin, we have a very special responsibility. A special responsibility for the people in Israel. So let us stand united by Israel's side, and let us come together in standing against terrorism, because terrorism wreaks havoc. It brings death and suffering. And the many people in Israel and in Gaza Strip who are now dying, the many children, they are dying because of the terrorists that attacked Israel brutally. And therefore, the people who are suffering there are in our thoughts. And we all hope that this terrorism, this act of terror will come to an end, and that peace will prevail in this region and all other regions of the world. And now it's very difficult in these trying days to turn away from those events and look towards more pleasant events. For instance, this award ceremony. With this award ceremony, Berlin gains even more international renown and reputation. So I'd like to give my thanks to the Virchow Foundation for Global Health and, of course, to the many donors. This prize is such a perfect match for Berlin, ladies and gentlemen, because Berlin researcher and politician Rudolf Virchow, after whom the prize was named, is the very epitome of medical excellence and social responsibility. With the award of the Virchow Prize for Global Health, we will be honoring a researcher whose biographical and social experiences have encouraged her to outstanding research. Professor Leke comes from Cameroon originally. She had to see for herself how malaria, this malicious disease, can wreak havoc on a society. A vicious circle of illness and poverty. According to the World Health Organization, more than 500,000 of people die from malaria every year. Most of them children, and most of those in Africa. For centuries, malaria was an unconquerable plague. Fortunately, there are now 2 vaccines, and I say fortunately. That is a glimmer of hope indeed, ladies and gentlemen. The hope that one day this perilous disease could one day be eradicated. And by honouring Professor Leke today, a distinguished and outstanding infectious disease expert, we are also casting a light on the excellent scientific expertise of African universities and research institutions. They play a crucial role in scientific breakthroughs, for instance, in malaria research. Making this scientific excellence, ladies and gentlemen, more visible to a general public here in Berlin is also a major achievement of this award. For we all know, cutting-edge research today, more than ever, is the result of international connectedness. And as one of our latest achievements, I'd like to name the Global Hub for Pandemic and Epidemic Intelligence. The establishment of the WHO Hub was an important step towards making sure that we understand the fight against and the prevention of pandemics as a challenge for humanity, a challenge which we need to continue to meet in a concerted effort. And the fact that Berlin was able to develop into a world-leading healthcare location was also thanks to its enormous attractiveness to world-class researchers. Around 390,000 people work in almost 22,000 companies in Berlin in the public healthcare sector. Roughly 22,000 companies generate a turnover of 30 billion euros. In Berlin, in our city, we have 145 hospitals and clinics and roughly 40 reputable scientific and academic institutions. Among them, of course, Charité, the Robert Koch Institute, the German Heart Center Berlin, and many other notable institutions. Our flagship, Charité Berlin, ranks among the top 5 hospitals in the world. And also with regard of the innovative fields of AI and big data, the capital region is strongly positioned with the Berlin Institute for the Foundations of Learning and Data, bifold. But what is most important to me is, behind the renowned research institutions are brilliant researchers. It is them who are responsible for scientific excellence. And ladies and gentlemen, and Professor Gant and Professor Price, as governing mayor, I do know and are very well aware of the importance of science, technology, research for our city and in the capital region, Berlin and Brandenburg. And I'm well aware what the healthcare sector means for Berlin. And you can rest assured that the Berlin Senate will do everything in its power to make sure that Berlin, as a location for science academia, as a healthcare location, will be further promoted so that it can continue to grow in the future, so that the world can look to Berlin when it comes to health science, public health, and new technologies. And because we are an international metropolis, we will only be able to achieve this if we create networks and foster ties and work together internationally. And I think Berlin is best positioned to do just that. So it's wonderful that all of you are here tonight and that we use the Virchow Prize to raise the profile of these issues. So I'm delighted about the large international attention that this prize ceremony draws. I look forward to the World Health Summit starting tomorrow in our city, in Berlin. I wish all of you a wonderful stay in Berlin, the #1 international city in Germany. During the conference, I wish you a good outcome, inspiring and constructive meetings, so that we can make sure that pandemics, epidemics can be better fought, and that people all over the world will be provided with good health care. Thank you very much for having me. Thank you very much for your attention. And I wish you the best of luck and every success, and enjoy Berlin. Thank you.
Thank you very much, Mayor Wagner, for a great speech and reminding us of the legacy of this great city, also honoring what we have to come in a couple of days around global health, but what already lives here in the pandemic hub. I see my brother here, Chikwe Hekwazu, the Assistant Director General from WHO, who heads that hub. Berlin, indeed, and Germany is a great country for global health. It is a distinct privilege now to introduce the President of the German Bundestag and the High Patron of the 2023 Virchow Prize for Global Health, Ms. Babel Baas. President Baas unfortunately cannot join us in Berlin today. However, she will be back, I'm assured, ma'am, and she will host a dinner at the beginning of next week to personally welcome and honor Professor Rotes Leke as the 2023 Virchow Prize laureate. So now, over to President Baas.
Health is a key to a good life and to a better world. As a senior health policy maker, I know about the intricate web of interrelations between health, education, economies and social backgrounds. Raising awareness of these interrelations is fundamental, entirely in the spirit of Rudolf Virchow. During the coronavirus pandemic, we made the painful experience of how closely and globally all of our health and well-being is interconnected. We saw that one virus can bring entire countries and societies to a standstill. These events have helped enhance the public's awareness of the importance of health. We live in a country with a very robust healthcare system, regardless of the problems we too face.
Der Virchow Preis für globale Gesundheit erinnert uns daran. Als Schirmfrau freue ich mich, dass dieser wichtige Preis in diesem Jahr an Professorin Gana, Fomban, Leke geht. Liebe Frau Leke, Ihre bahnbrechende Forschung zu Infektionskrankheiten hilft Menschen weltweit. Seit Jahrzehnten kämpfen Sie für eine malariafreie Welt und betonen immer wieder, Malaria ist nicht nur ein gesundheitliches, sondern auch ein gesellschaftliches Problem. Ich finde es großartig, dass Sie sich auch für eine gleichberechtigte Teilhabe von Frauen in der Wissenschaft einsetzen. Das ist ein großer Verdienst. Leider kann ich heute nicht persönlich bei Ihnen sein. Ich freue mich aber sehr auf unser Kennenlernen und möchte per Video sagen, herzlichen Glückwunsch zum Virchow-Preis 2023 und vielen Dank für Ihr beeindruckendes Engagement.
Dankeschön, President Baas. I'm now pleased to introduce the President of the Virchow Foundation for Global Health, Professor Gerald Haag.
Dear Mayor Wagner, dear Dr. Alakia, esteemed guests, friends and colleagues. It is my honor and immense pleasure to welcome you to this very special evening, the second Virchow Prize for Global Health Award ceremony held under the high patronage of President of the German Bundestag, Bärbel Baas. Thank you to Dr. Alakir for excellently hosting the ceremony of this evening and for sharing your personal reflections on the Virchow Prize. And my sincere thanks to you, Mayor Regner, for your opening words, which emphasize your vision and leadership for expanding global health engagement in Berlin. Tonight, it is difficult to proceed as we would have wished in more peaceful times. Two of the most important sustainable development goals are international partnership and peace and justice. The terrorist attacks on Israel and the Russian war of aggression against Ukraine leave us devastated. They are to be condemned, and we sincerely hope that both wars will end soon. Our thoughts are with the victims and their families. We are here to honor an exceptional individual whose dedication, passion, and tireless efforts have made a significant impact on global health. Professor Rotes, Gana, Fomban, Leke. Rotes Leke's exceptional lifetime commitment and achievements in strengthening global health and pioneering infectious disease research recognizes the need to rethink malaria as a societal and development problem, beyond the purely biomedical lens to achieve a malaria-free world. Simultaneously, she has shown relentless dedication in advancing gender equality, paving the way for policies and programs to prioritize gender-sensitive healthcare, and empowers women and girls to lead a more confident, healthy, and self-determined life. The Virchow Prize for Global Health is not just an award. It is a celebration of the unwavering commitment to improving the lives of people around the world. It is a recognition of those who work relentlessly to address the most pressing health challenges, who advocate for the vulnerable, and who inspire us all to strive for a healthier and more equitable world. I and my fellow co-founders established the Virchow Foundation for Global Health with a clear mission: to broaden public awareness on the importance of global health and to establish even stronger partnerships towards mobilizing the attainment of the United Nations 2030 Agenda Sustainable Development Goals, the SDGs. In the spirit of Rudolf Virchow, as we've seen, a renowned physician, anthropologist, a social reformer, after whom the prize is named, we are reminded of the interconnectedness of health, social justice, and human welfare. There are a few people who have such a holistic approach to health as Professor Leke. In the spirit of Rudolf Virchow, to overcome all obstacles, and has made fantastic progress for health possible. On behalf of the founders, I would like to extend recognition towards the members of the Board of Trustees, the Council, and the Virchow Prize Committee for the commitment in ensuring the success of the Virchow Foundation and the Virchow Prize. Without their joint commitment, our ambitious mission could not be realized. So, congratulations once more to Rotes Leke, a very well-deserving laureate of the 2023 Virchow Prize for Global Health. Thank you on behalf of the Virchow Foundation, and I wish you all, us all, an enjoyable evening. Thank you.
Thank you, Professor Haag. Thank you, Professor Haag. And to conclude the opening of this segment of this ceremony, I'm pleased to introduce the final speaker, last but not least, my brother, the Director General of the World Health Organization, Dr. Tedros, who unfortunately is unable to be with us today. As you all know, there are many, many things going on in the world, and he regrets very much being unable to be here in person, but has provided us with a video message. Cue video. Thank you.
Honorable Governing Mayor of Berlin, Kai Wagner, dear colleagues and friends, I'm delighted to welcome you to the 2023 Virchow Prize for Global Health as we honor 2023 laureate Emeritus Professor Rotes Leke. I congratulate Professor Leke for her leadership and exceptional achievements, her dedication to advancing gender equality and women's participation in science, and her pioneering research. In addition to her many recognitions and awards, Professor Leke has served on scientific advisory committees for WHO and other global institutions. I wish my best to Professor Leke and to all global health colleagues as we carry forward the legacy of Dr. Rudolf Virchow. My thanks also to Germany and the city of Berlin for your leadership and partnership, including by hosting the WHO Hub for Pandemic and Epidemic Intelligence and the World Health Summit. Vielen Dank. I thank you. Once again, congratulations to Professor Leke.
It is my pleasure to now transition to a special musical interlude. I am very excited, so I hope you enjoy it too. While the Virchow Prize for Global Health is an international award aspires for global engagement and new partnerships for health for all, as we've been hearing, it is rooted through its namesake, Rudolf Virchow, here in Berlin. But this being said, when it comes to musical and cultural ambassadors of this city, the Berlin Philharmonic Orchestra is second to none. So it is with great pride and joy that I warmly welcome and present an amazing ensemble of outstanding musicians, the brass quintet of the Berlin Philharmonic Brass Ensemble, featuring William Gell, if they could please proceed. Thank you. Thomas Valenci, trumpets, Sarah Willis, French horn, Olaf Ott, trombone, Alexander von Pottkammer, tuba, and a very special thank you. And a very special thank you to Sarah Willis, who made the presence of the quintet possible this evening. They've promised me that I don't have to play any instruments or sing, so I shall exit stage right.
Good afternoon, good evening. I'm Sarah Willis, and I'm very proud to be standing here at this incredible event with my colleagues from the Berlin Philharmonic, and you did a great job of pronouncing the names. Well done. We have a little change in our schedule today. Roland, you're looking a bit worried, but we have a concert at 7 p.m. in the Philharmonie. That's why we've come in our penguin clothes, and our concert is being broadcast live. And as always, in these wonderful occasions, all the planned speeches always go much longer, don't they, than planned. And so we were planning to go off, and then there was going to be the prize giving, and then come back again. The problem is, it's getting a little late. So we thought, if you wouldn't mind, we do have 2 short pieces that we were going to play for you at the end, and we'd like to play them now, if that's okay with you. So, and you're all welcome at 7 p.m. to come over to the Philharmonie for the concert. But thank you for the invitation, especially Roland Goethe from the Goethe Foundation. You do so much for the world and also for culture, and we appreciate it so much that we can be here. The first piece was by Albinoni, Tommaso Albinoni, and now it's supposed to be, in German we call it a Rauschmeißer. It's this thing to get everyone standing up and leaving, but please don't leave because it will carry on. But we'd like to play it for you anyway. It's called the Music Hall Suite, and it's a lot of fun. So it's lovely to be here, and we're out of here after this. But enjoy the evening.
Thank you very much to the incredible quintet, Sarah Willis, MBE. They say if you want something done, get a woman to do it. We're about to hear about that tonight. You know, when I arrived today, they sort of said, oh, you're the master of ceremony and you're the master of ceremony. I said, well, actually, I'm not a master, I'm the mistress of ceremony. And we're following that theme today. So you would have heard them announce earlier, your books are a little behind in time, it still says master, but you'd have heard them announce earlier, mistress of ceremony. I say that because we're now transitioning to the serious business of the evening. We're here to honor and to celebrate the 2023 Virchow Prize for Global Health laureate, Professor Rose Gana Fomban Leke. To further introduce Professor Leke's accomplishments and to provide this evening's laudation speech, it is my pleasure to introduce to you a close colleague and friend of hers, but also my dearest big sister, the WHO Regional Director for the Afro region, Dr. Matsusidio Rebecca Moeti. It is a special moment here in Berlin and a historical moment, and almost emotional for me, that we have generations of African women standing together here on one stage. So for me, I want to acknowledge that we stand on the shoulders of giants. And both of you are some of the giants on whose shoulders people like me have stood. So big sis Sidi, I hand over to you and I honor you both.
To adjust my mic, the younger sister's so much taller. The Honorable Mayor and Governing Mayor of the City of Berlin, Professor Gerald Hogg. In her absence, I acknowledge and thank the President of the German Parliament, members of the Virchow Foundation Board, Professor Leke's family. What a wonderful surprise that your kids are walking in one by one and shocking you by their presence. Thank you to the family so much for being here. Excellencies, colleagues, partners, and friends, and our wonderful Mistress of Ceremonies. It's a great honor and pleasure to be back in Berlin and to deliver what in the tradition of my Xhosa forebears and family in South Africa would be called the praise poem. So Rose, this is my Xhosa praise poem on behalf of African people to you, or to offer you a laudation and to honor you as an African woman whose work, like that of Rudolf Virchow, has pushed the boundaries of global health, immunology, infectious disease control with a relentless focus on equity and fairness. You, Rose Gana Fomban Leke. I've had the enormous privilege of working closely with Professor Leke in the critical role she's played in polio eradication, for example, and in the independent advisory group that I established when I took office as a regional director for Africa. But your contribution to improving the health of African people, Rose, has through us benefited from your broad, multifaceted engagement in global health, so not just polio. I echo the sentiments of those who've spoken before me, all of whom have recognized your work, and thank you. Today's laureate, ladies and gentlemen, is a scientist whose work cuts across the global, the regional, the national levels, encompasses scientific research, policy recommendation, political mobilization, implementation, evaluation, and learning, and very, very importantly, engagement of communities. Professor Rose Leke, a dedicated teacher a rigorous scientist, a prolific researcher. How many papers have you published, Rose? An innovator, a straight but humble advisor, a compassionate heart, a defender of marginalized people, a polio eradication champion, a malaria control fighter, a driver of gender equity, and a mentor to women and girls, and above all, a devoted family member. She embraced these various responsibilities, her life's work, with enormous positive energy, rigor, enthusiasm, humor, optimism, and compassion. She has served on numerous WHO advisory committees at the global and regional levels. I will not name them here, and for decades. On diseases that are particularly prevalent in Africa, where investment in intervention tools has been a challenge for decades sometimes, and the best scientific work to make breakthrough is critical. Diseases like malaria, and also lymphatic filariasis and onchocerciasis. Rose, if you will forgive the informality, I will call her that way, led the African Regional Certification Commission for many years, and she determinedly supported our polio eradication goals. She wasn't shy about getting her hands dirty to get the job done. She didn't sit around in air-conditioned rooms in the capitals of developed countries or in Africa, but ventured deep into the field to engage with underserved communities, with local leaders and health workers, bringing that first-hand experience to policymakers at the national, regional, and global levels. Her constant message has been, we need to finish the job. Her resolve and consistency have inspired me, has inspired our WHO Afro team, has inspired health ministers and experts in our countries. An example, once we noticed a spike in polio cases and called her, "Prof, we have some bad news." She responded, no, it's not bad news. We detected the cases, and that's getting half of the job done. These efforts paid off. On the 25th of August, the African Regional Certification Commission for Polio Eradication certified the WHO African region as wild polio-free. Prof. Leke's joy, like mine and my team's, our health ministers, knew no bounds. We danced together when the news was announced, and she's been relentlessly dedicated to preserving this status and to the response to the cases of circulating vaccine-derived polio in the region. So we share the determination that the world's poorest region sustain its great achievement in polio and prove that when resources and health tools are availed equitably, people everywhere can benefit. That leads me to her relentless dedication to advancing gender equity. She was inspired by her own experience of gender inequity at work, her observation of this phenomenon in the region and across the world, I dare say, to mobilize international support to train young Cameroonian, then African women scientists and researchers. This, in addition, I have to say, if you look at her CV, to having trained many male experts as a professor at home, of course. She took this further, translating her recognition of young women scientists' need for role models, for coaching, and for support into action. She and a few senior women scientists obtained funding, which they used to organize training and informal exchange sessions for early career women scientists. Their network has grown into the Higher Women Consortium. Today, some of Rose's mentees are principal investigators, have won outstanding research awards, and are often featured in major international media, thus in turn inspiring other women. They are contributing to driving gender equity in science and health in Africa. Ladies and gentlemen, I can't finish without extolling Prof. Leke's pioneering, well-renowned research as an immunologist on malaria and on other diseases that particularly affect people in Africa, which has resulted in transformative action and tangible result. She played a critical role as a researcher and policy advisor in contributing to the fact that today we have the R21 vaccine, which is effective against malaria, building on the experience with the RTSS vaccine, on which pilot programs have been carried out in 3 African countries. So Rose. So Rose, thanks to you, that #1 killer of African children, malaria, is poised to be transformed today. Thank you for your contribution to that work through your decades of research, advocacy, and work in the field. The beauty of Prof. Leke's long and diverse work lies in how she united global partnerships across continents, working with institutions not only as WHO, such as the Bill and Melinda Gates Foundation and the Global Fund, while going down to local communities in her home country, Cameroon, and in many other countries that she visits. We're grateful, Rose, for all that you have done. And we thank your husband and family, your steadfast support in the work that you've done. We celebrate the lives that you have touched, the hope that you've inspired, the light that you've illumined in every community free of polio, and in every African girl and woman who works to end diseases and suffering in this world. Congratulations, Prof. Leke. Hala hala, as we would say, to end in Xhosa. And I can't end without ululating, since that's what my mother would expect me to do. So, So it's my great privilege, as instructed by Yodi, and who can dare disobey Yodi, to invite you, Rose, to come up to the stage.
I please now invite the founders of the Virchow Foundation for Global Health, Frida Springer, Gerard Haag, Detlev Ganten, Christoph Marchis, and Roland Guder, to please join us up on stage. And next, as I get out of their way, I would like to invite the Mayor, Mayor Wegner, to please join us on stage. And we're about ready to present the trophy and the certificate.
I was asked, dear Mayor, dear Mistress, to explain with some words the wonderful trophy here. Definitely this is a wonderful piece of art you will get, dear Rose Leke, in some seconds. But it's also a kind of symbol and a historical object. This is a jar from the lab of pathology Rudolf Virchow used. And this is for you. So there is a link between you and Rudolf Virchow. I'm the president of the Berlin-Brandenburg Academy. Virchow was our member, and we have lots of papers of Virchow, but this wonderful jar we haven't. It's from the Medizinhistorisches Museum, the Historical Museum of Charité, and there will be a duplicate of your wonderful trophy so that all Berliners and all visiting the wonderful museum can look to this object. because it's not only a historical object, as you can see here, yes, exactly, on the screen, there is something written in. And this, Rose, are some words of you. These are Rose Leke words, which all people looking to the second trophy in the museum in Berlin can also look at. And if you look here, there are two researchers, female researchers, on top of the words. And these are symbols for your devotion and energy for younger and female researchers. So, this trophy is a wonderful object of art, a historical object, a Rose Leke object, but it's yours now. And that's the most wonderful thing, and we congratulate you heartfully. Here is your trophy.
I'd like to invite us all to gather for a picture. And now, the laureate's speech. Ma'am, it is my pleasure to invite the Virchow Prize laureate up to deliver her remarks. Behind every great woman, there is always an even greater, maybe, man.
That's why I said besides.
Well done, ma.
Oof. Wow, I'm overwhelmed. If you were in my position, I don't know how you will be, but really all protocol respected. I just want to say my own welcome and thank you for taking time to join in this celebration in beautiful Berlin, where I find myself from 2 days ago, and to celebrate 3 cardinal virtues that are very near and dear to my heart. And those are innovation, resilience, and community, as you've heard from the previous speakers. So I stand before you today profoundly grateful and deeply honored to accept this prestigious Virchow Prize for Global Health, initiated by the Women in Global Health. This award symbolizes our collective commitment to addressing the myriad of health challenges that unite us all as a global community and illustrates our commitments to striving for a world where good health knows no boundaries. Please join me in thanking the Virchow Foundation for this prestigious award. Please join me in thanking them. Can I have a hand? Thank you very much. Thank you. I want here to acknowledge, I'll make some acknowledgements. I've gone through a life, and I really want to acknowledge the extraordinary journey that has brought me here. It is one that has been marked by unwavering support of countless individuals and institutions, beginning with my beloved parents, both of blessed memory. None of my professional accomplishments would have been possible without them. Their visionary guidance the belief in me, and the willingness to defy traditional norms by investing in the education of their daughter. Didn't happen then. Sow the seeds of curiosity and learning that have propelled me on this remarkable path. My journey has also been illuminated by unwavering support of my family. Some of them are here from Cameroon, amongst them, of course, my dear husband for 53 years, Robert Leke. My children, who have really surprised me because only one was coming. Now all four of them are there, Nglan, Acha, and Efwa, and Junior. They're just sitting behind there. It was my biggest surprise. They were not coming, and they're all here. My younger brother, who is the head of our family now, Gana Fomban, and Anna Marge, who are here with us, and my sisters, Nyong, Regina, Elizabeth, and then I have the representative of the Fund of Bali, Mr. Edwin Fongad, and also the Bali community. You can see them here, the Bali community in Germany. They all are here today, and my daughter Joanne, she's someplace in there also. So I have also received tremendous support and guidance from family and friends. Young and Klaus are here. Some of my family and friends who cannot be here present today, I even have the clergy, our one and only Archbishop Andrew Nkea, who is still at the airport trying to get here, but he will join us. And then I have the Higher Women Consortium of Cameroon. You saw the pictures. Higher Women, there they are there. You can have Stephanie Vodo and Professor Tori Miro there. I've had women's religious groups and social groups that I'm involved in, and all of these have stood by my side as I balanced my career and family. So your support provided the foundation upon which I could build and further realize my purpose, which has always been to address global health disparities. I extend my heartfelt gratitude also to educators who have shaped my journey from my formative years to the universities I've attended. I must also express my appreciation to the government of Cameroon, represented by Ambassador Stendoki, who is here, and the University of Yaoundé 1, Faculty of Medicine and Biomedical Sciences, and the Institute of Medical Research and Studies of Medicinal Plants for the pivotal roles in my academic and professional growth. A debt of gratitude goes to Dr. Dan Taylor and her dedicated research team at Georgetown University, as well as University of Hawaii, and all the members of the multidisciplinary research team that are led in Cameroon, where we did all the work. Our true collaboration with funding from NIID and others enriched my academic journey, leading to groundbreaking contributions, as you've heard, in the field of malaria, and training over 100 Cameroonian medical master's PhD students over the years. And thanks to Roger Glass and the Fogarty International Center for this training. A big thank you goes to David Gold and all my friends at Global Health Strategies. Together, we forged new pathways in the fight against infectious diseases. I'd also like to thank the broad WHO community. We've heard from the director, the regional director, and particularly to the polio and malaria teams in Afro and at headquarters, and particularly also Bruce Aylward, who really guided my initial steps into the complex realm of polio eradication. And to the GPA, Global Polio Eradication Initiative partners who are working with governments and the community, and I extend my heartfelt appreciation. The dedication and wisdom have been invaluable in our battle against polio. I'd like to acknowledge also Pedro Alonso and Professor Diane Worth, whose respective stewardship of the Global Malaria Program and Harvard's Defeating Malaria Initiative has been instrumental in our quest to control and rethink malaria. The milestones that we have accomplished along the way would not have been possible without the unwavering partnerships. I was appointed chair of Gavi's Independent Review Committee in December 2022. This was an important moment in the evolution of the global health as countries started to rebound from COVID-19 pandemic, and Gavi was looking forward to integrating important lessons from that period into future operations aligned with its mission of advancing immunization access and equity worldwide. I must also recognize the efforts of many colleagues I've met along the way, the grassroots activists whose tireless dedication to the cause of immunization has saved millions of lives. The work that they all do and all our work is a cornerstone of global health, and I thank you all for the resolute efforts. The landscape of science in Cameroon, particularly for women scientists, has been transformed by the Higher Women Consortium and Women in Global Health. The Higher Women is dedicated to helping spark interest in science among girls in Cameroon and providing present and future female scientists with the mentorship and support needed to establish their careers. I salute all those who have partnered with us in our mission to turn this vision into reality. WHO TDR, IDRC Canada, L'Oreal Foundation, Dangote Foundation, UN Women, the Canadian IDRC. In lifetime achievements in malaria and polio, really I'm deeply honored to receive this award as a reflection of a lifetime dedicated to making a meaningful contribution to global health. My personal experiences with malaria were foundational in driving my commitments to ridding the world of infectious diseases. As a young child, I survived malaria when so many of my peers were not so fortunate. And those experiences left an indelible mark on me. And in adulthood, I had more encounters with the disease, including my own infection with malaria during pregnancy. Living to the age of 76 on a continent where the average life expectancy is 64 years is a privilege. Africa faces many health challenges, from polyparasitism and malnutrition to poor hygiene and sanitation. Investments in malaria control have not yielded the dramatic reductions in mortality that were hoped for, and the coexistence of non-communicable diseases further complicates the landscape. Rudolf Virchow, whose name bears the prize I have the honor of accepting, made groundbreaking contributions to our understanding of malaria's pathology. His work is a testament to the importance of collaboration, key partnerships, and multidisciplinary efforts in global health. Our hope for some progress has been raised, as you heard, by the first 2 new vaccines that we have now for malaria, and countries are soon starting to vaccinate children. My journey in malaria research has been marked by pioneering studies in the diagnosis of malaria during pregnancy, on the acquisition of immunity among pregnant women, and its role in reducing placental pathology. Our efforts have shed the light on potential of R2CSA-based vaccines for pregnant women, offering hope for improved maternal and child health. We've also studied the acquisition of immunity among infants during their first year of life, uncovering valuable insights into their initial responses and the role of maternal antibodies. And I consider it a privilege to have seen my journey in malaria research begin at the scientific bench and evolve through to policy and advocacy. This journey is partly where I stand today. My work in polio eradication, you've heard from my regional director, my little sister, Chidi, has been another remarkable journey that began in 1999 when I was appointed the chair of the African Regional Certification Commission. This commission worked tirelessly on advocating for improved surveillance and routine immunization, and in the preparation and reception of each country's documentation for polio-free status. I read the declaration on behalf of the Commission. declaring the African region free of indigenous wild poliovirus on August the 25th, 2020, and handed the certificate to the regional director, Dr. Moeti, here present. There remains more work to be done, but I'm confident that we will finish the job. The triumph over polio amid the COVID-19 pandemic is a testament to the power of partnerships, persistence, collaboration, and science. The lessons learned from the collective effort to eradicate polio can inform our approach to combating other diseases. And I'm honored to have been part of this momentous effort at the regional and the global levels. And as we reflect way forward on our past achievements and continue to grapple with challenges of pandemic preparedness, climate change, we must also look resolutely to the future. The rise of big data, genomics, digital technology, they present new frontiers for healthcare. We must harness the power of data to inform decisions, address challenges, and drive innovation. Implementation science plays a vital role in bridging the gap between knowledge and practice. Mathematical models increasingly used to understand complex health challenges and simulate intervention scenarios. However, interdisciplinary teams are needed to harness the full potential of all these models, and this is a gap that we must address. The third Sustainable Development Goal emphasizes good health and well-being, underscoring the importance of holistic wellness for humanity. To achieve SDG 3, we must address the burden of multimorbidity, bridge gaps in research, and strive for gender equity in healthcare. As we look forward, we must right the underinvestment in African women scientists. I promise you, we'll be blown away by the results that will come from dedicated efforts to mentor and support women scientists and researchers who are tackling some of the continent's most intractable challenges. And I commit to continuing to play my role with the support of this award to further sustain these efforts. Higher women. Let us remember the legacy of Dr. Virchow, whose collaborative and multidisciplinary approach paved the way for the progress we have collectively achieved in global health. As I said at the beginning, I'm standing on the principles of innovation, resilience, and community. Let us continue to strengthen and integrate systems for health with equitable and collaborative partnerships. And let us come together to achieve the goal of a healthier Africa and a more resilient world. I thank you all for this tremendous honor and for your unwavering commitment to global health. Thanks to the Virchow Foundation. Thanks to all of you. Grateful for all your time. Thank you.
I just hope you will all allow me to invite the family, Professor Rose Leke's family, up to have a photo very quickly. It's not in the program, but you know what? You know, like really, please, please. The children as well. Yes? incredible, inspiring. Yeah, wonderful. That was just so beautiful. Thank you, ma'am. Thank you so much for all you've done. Thank you for inspiring us. Thank you for showing us what it can look like. Thank you for your life of dedication to humanity. Thank you. Thank you for showing us African women what love can look like, what life can look like, what success can look like. It's difficult to sort of move on after that, isn't it? You sort of want to sit in it for a minute and just... But you know, it's German precision. Have to get going. So I'm going to switch. And so although tonight's ceremony is nearing its end, it also marks the beginning of another exciting meeting for global health with the World Health Summit. And I wear another hat as a World Health Summit ambassador. So I'm very proud and very pleased to welcome to the stage co-founders of the Virchow Foundation for Global Health, Roland Gude and Detlef Ganten, as well as the president of the World Health Summit, Professor Axel Price.
I agree with the mistress of this ceremony. Take a breath. But life goes on, and we want to have a celebration for those who improve global health every year and every year in Berlin. And that's why we are coming to the end of the ceremony, but we are starting the nomination period for the next year. And this is being announced by Roland Gude, the CEO of the Virchow Foundation. Roland.
What a special moment, what a wonderful, amazing evening. And I'm here to building a bridge to the World Health Summit, and the, let's say, handing over of the baton will be taken place in a few moments with Professor Detlef Ganten and Professor Axel Price. But I'm very happy to announce following. Since establishing the Virchow Foundation for Global Health on the occasion of Rudolf Virchow's 200th birthday, the founders have been driven by the vision and mission to shape an international award honoring lifetime achievements towards health for all over the entire wide spectrum of global health. Well aware of the immense challenge this vision comprises, it's entirely shared, sustained and supported by our esteemed honorary members of the Virchow Foundation Board of Trustees, its International Council and the independent Virchow Prize Committee, as well as many great partners, colleagues and friends to whom all we extend our most sincere gratitude. At the same time, the Virchow Prize is an award dedicated to and for the entire global health community and beyond. At this night, we are so richly inspired by our truly wonderful 2023 laureate, Gana, Fomban, Leke. Please let us carry this inspirational spark and light towards all areas in global health, leading to stimulating and submitting nominations worldwide from the entire spectrum, may it be planetary health, climate and health, One Health, mental health, NCDs, health and education, and all the many other important fields. The contribution of all of you will be crucial and imperative to reach our joint goal. After end of each annual nomination phase, the independent Virchow Prize Committee will continue to select the laureates in entire and exclusive loyalty to the prize's eligibility criteria, while the achievements to be honored must rest on a fundament of human rights, solidarity and equity, and be rooted in research and academic values. Cordially inviting you all to shape this night's special momentum towards actively contributing to realize our shared vision. It's now my distinct honor, privilege and pleasure to declare the 2024 Virchow Prize for Global Health nomination phase open. Thank you so much.
As you all know, we need role models, and the Virchow Prize winners are role models, examples for everybody who wants to improve health around the world. But we all know not one person or just a small group of persons can do it. We need partnership. And that's the reason why goal number 17 of the Sustainable Development Goals is partnership for the goals. And I welcome you all. You're all partners. You're all prominent members of various organizations helping us to improve our common goal, health for all and well-being for all. In Berlin, we have established a strong partnership among various organizations, and one of the important international partners, of course, is the World Health Summit, and many of you are coming and joining us for the World Health Summit starting tomorrow. And the president of the World Health Summit is Axel Priest, and he is going to tell us what he thinks about the World Health Summit this year.
Thank you very much, Detlef, but I normally follow your orders, but you're giving me the chance to advertise the World Health Summit. I won't do that because this was such a impressive situation here that I don't want to spoil it at the end with something else. You will live up tomorrow for the World Health Summit, but today we are here for the Virchow Prize. And we have seen how vision can be important to change the world. We see it with Rose, we see it, we have read about it in the literature with Virchow. And it needs vision, but it also needs sustainability, or, as you say, persistence. And one German philosopher said, health is not everything, but without health, everything is nothing. But I would put it one notch further. Health is a major or the foundation, but also an indicator of good life and of functioning societies. Without health, there is no good life, and if a society is not healthy, including mental health, it's not a good society. So how can we do it? Because we saw in the COVID crisis that the population, yes, is willing to look to health, but only in these crisis cases, and only for a short period of time. And afterwards, trying to forget about it and do business again. But we have to convince the population that you have to invest into health each and every day. That will increase your livelihood. That will also increase, like Mayor Wegener said, your economical basis, because you will do stuff which is good. And we have to learn how to put health on the agenda every day, not only in crisis days. And I have no answer to that, but I say at the end, how can we learn from Virchow? How could he make health at his time a focus area of the Berlin government and of the Prussian government very effectively? And can we learn from Rose? How could you achieve your breakthroughs in malaria? We won't learn that this evening, but what we learned from the Virchow Prize Committee, from everyone sitting here establishing the Virchow Prize, we can learn that visible events, very impressive people can help us to put health on the agenda, and we do that today, and we do that the next days also at the World Health Summit. Sorry.
Learning is the last word of Axel's and will be the last reflection of mine. Education is Sustainable Development number 4, education. And education is about learning. And Rose, we met yesterday evening, first time in my life, in our life. And we learned already the last 24 hours from each other. And I know and I learned that the African continent is present here. And you have seen that from, this Mayor Kai Wegener, this is taken over by Africa now, this festival of the City Hall. And what we can learn from Africa, and what we can learn from Rose and her friends and her family and her fighters for better health, and that is, despite all the misery, which we are all going to see, and we try to help wherever we can, the main thing is optimism. You have to be optimistic, and you have to convey optimism that better life is possible and healthy life is possible. And how can you show optimism better than by African dances? And I've heard, Rose, that your group is ready to dance on stage and show us how African optimism is expressed by dancing. So if you're ready, come up to the stage and show us African dances.
I just wanted to very We'll say in my language, which is the Yoruba language, Ati da Berlin Ruleni. We have scattered Berlin today. We brought Africa to Berlin. Thank you so much. Thank you so much for a wonderful, 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 the culture. It was wonderful to see the culture sort of juxtapose the Philharmonic and then the African drums. I was a bit worried there for a minute because, you know, in my household, when drums start going, my daughter tends to hold my hips because she says, "Mother, you can control yourself. It's okay." But there's something inside that with those drums, the body just can't keep still. So I'm doing really well right now, but it's time for the reception, I can tell you. It's time to go really dance. So really, what an amazing evening. This is the final segment of the evening, and we are there, but we're not, because the celebration of you, ma'am, just begins. And I'm really pleased that you're going to be here for this week, to be honored, to be celebrated. We'll celebrate you tomorrow night. But every day we shall celebrate you, because you have done so much for our continent. You have done so much for women. You have done so much for the world. So we give really, really, really great thanks to you and really honor you today. And so as we close today, as we stand on the precipice of global change, grappling with the challenges that threaten to destabilize our collective peace, that threaten to destabilize the world, it is paramount to remember those who refuse to stand idly by, like Professor Leke. It is really paramount to remember the brave souls who don't merely battle today's problems, but defy the passivity that often creeps upon societies, lulling us into inertia. We heard her talk about how her own battles with malaria and pregnancy, malaria as a child. You know, I remember, you know, my grandmother trying to force potions down me that had been made in bottles with bark, you know, after horrible bouts of malaria. I remember even then I was a rebel. I remember running away once. I don't think I got very far because I was trying to avoid the malaria potions because they were so horrible and so bitter. But today we have a malaria vaccine. 2 malaria vaccines, and a lot of that thanks to you and your tireless work, and so many others, yes, but thanks to you. So while the world chases fleeting moments, fleeting fame, fleeting wealth, there are those like our esteemed laureate, Professor Rose Leke, who spend their lives not in pursuit of personal gain, but in the selfless quest to rewrite the narratives of suffering and of disparity, of inequity in this world. It is not just an act of bravery, but one of profound love for humanity. And you spoke today of your own faith and that love for community and that love for humanity. It is love that will bring this world together. It is not hate. It is not division. It is love. It is love. It is coming together. It is partnerships, as we just heard, looking at Virchow and the World Health Summit, that partnership, that coming together, it is what will unite this world. In the spirit of this evening, let us not forget that as physicians, scientists, global citizens, we have a duty to be audacious, to challenge conventions and to push boundaries. So let tonight, as we've seen our worlds coalesce, we've seen our worlds converge, we've seen Europe and Africa, our complicated and yet interlinked history, we've seen them come together, and we've together been on this stage. Let it serve as a beacon and remind us of our shared mission, partnerships, to tackle the world's grand challenges head on. For as Rudolf Virchow so insightfully stated, it is the curse of humanity that it learns to tolerate even the most horrible situations by habitation, that it forgets the most shameful happenings in the daily shame of events, and that it can hardly understand when individuals aim to destroy this infamy. Friends, partners, colleagues, we are at a precipice of history. It is partnerships, it is togetherness. As Rudolf Virchow stated, it is the curse of humanity. If we were to bring it into today's terms, it is a slow boil of the frog. Professor Leke spoke when she said earlier that we must not tolerate the things that we have chosen to tolerate as a community, as a world. So as we draw the curtain on the 2023 Virchow Prize for Global Health ceremony, I want to extend my deepest gratitude to each one of you for being a part of this commemorative evening. I've learned a lot. I sat there, tears in my eyes, I've laughed, I've danced, and I know many of you have too. And on behalf of the Virchow Foundation for Global Health, it's been a sheer honor to celebrate the indomitable spirit of Professor Rose Leke and her lifelong commitment to global health. It's been my honor to be your mistress of ceremonies, not master. And now, I want to thank you for joining us and tell you that the reception is over there. I hope the drums are coming with us. It's a time now to mingle. It's a time to have conversations. It's a time to gather and to take selfies. You know, we're having a selfie competition, but I'll tell you more about that tomorrow. So let's adjourn to the next room and let's enjoy some music. The Berlin Philharmonic have left, so it's Africa drums time. Guys, are you ready? Oh yeah, Ejekajo. Thank you very much. Good night.